Hi.
Hi.
So, Karina, you're back after about a year.
Yes.
I saw you a couple of visits a year ago. You came from Texas.
Yes.
And what did you come for a year ago?
I had a knee swelling, and I also had numbness on my hip, so it was kind of like a mid-torso to down to my mid-thigh area.
Okay.
It was like I had a tingling feeling. I couldn't feel it. Like it was just...
Right. And I only saw you, you only were here for a couple of days.
Yes.
I saw you a couple of visits.
Yes.
How did you do?
So the whole tingling feeling and just the numbness when I would lay on it, it went completely away. I didn't have that like immediately after coming to the sessions. I didn't have that anymore.
Okay.
So I was like, well, definitely that's some big changes compared to like other chiropractors that I've been to.
Okay.
I really haven't had any results with them.
Okay. Well, again, this is not a comparison of one versus the other. This is just you came here. We saw you a couple of times.
Yes.
The majority of the symptoms had been resolved.
Yes.
So why are you back?
Well, I went to see another chiropractor in Texas, and I kind of messed something with my shoulder. So when I would swing, I guess I had a tear or something, which I've never had it before, but it wasn't like a swing that I've done like...
So when you went back, you hurt your shoulder?
Yes, but this was after the chiropractor, after I had gotten an adjustment from him.
Okay.
Yes.
All right. We have your films from last year. I'm checking you today. But we're going to send you for new films, and then we're going to regroup later on in the afternoon.
Okay.
Okay? And the issue is, so you came back for a follow-up or to kind of see what's going on, if there's any changes. And what are you experiencing now? Like, why did you have to come back from Texas? For what?
I'm having like around the sacrum area,
okay,
like swelling there too, and then my knee problem is kind of like coming back up a little.
Okay.
So
how is the numbness though?
The numbness hasn't come back.
Okay, so that's good. That resolved in 2 visits.
Yes.
That's pretty cool. Okay,
yes.
So you're here today, back and knee.
Yes.
Mainly.
Yes.
Okay. So why don't we do this? Let's watch you walk.
Okay.
Let's examine you.
Okay.
And let's see where we're at. Stand over here, please. Let's have you walk back and forth several times, please. So what we can see is the left dimple is low, the right dimple is high. This is your normal walk. Okay, keep going. So as she's walking, yeah, you can see she kind of tilts up on that right side as she's walking. Keep going, please. She tilts on the right, but the left dimple doesn't move up.
Yeah,
the
I
right
feel a lot of support on my right leg because my left knee hurts, so I kind of lean more over this way.
Correct. And what you'll see is because the issue is the right pelvis, she's compensating on the left side now. And what she's doing is she's actually stepping on the back right heel on the right side. And the reason she's doing that, she has an AS pelvis. It's high on that side. So by supinating the foot going on the outside heel, it's balancing it out with the left side. That's why it's doing that.
Yeah.
Okay, so we need to balance that out for you.
The back of my knee, it feels like it's stretched out in that area. I don't know why. So I just support more my, when I stand, I just stand on my right side.
Okay.
Versus this side.
Okay. Can you walk one more time, please, and we'll get started. Okay. So we want to see a little more fluidity in her walk. You're a little rigid in your walk. Go ahead and have a seat over there. Let's get started. Starting at the base of the neck. Now, look up just a little. There you go. You've been here a couple of days, yeah? Enjoying the weather at least?
Yeah, I went out to Malibu yesterday.
Nice. Upper neck is clear today. T4, 10 points, left side. And sacrum, S1, S2 area. Okay, so we're getting T4, we're getting the sacrum. Let's go ahead and check the pelvis. Scoot forward just a little, please. Feet together, open and close the knees. Open and close. Good. Are your feet touching?
Yeah.
Please. Feet touching, open and close. Now, no. Feet are touching. Open your knees, close your knees. Like the butterfly, open and close. There you go.
Okay.
Now, first thing I want you guys to see is just me putting my fingers here. She has a lot of swelling here in the sacrum towards the left side. Are your feet touching, ma'am?
Yeah.
Open and close your knees with your feet touching. Open wide, close. Open, close. Right side only, please. Keep going. Open and close. When she does the right, you can see the shift of the left side. Do the left side, please. Okay. Now, when she does the left, it's not the SI joint or the PSIS. It's not the dimple that's shifting. It's actually happening at the sacrum here. Do you feel that? Mm-hmm. I'm feeling it there. Okay, scoot back for me, please. Head down, round your back for me. Good. And let's statically palpate. And the first comment I want to make is there is overall swelling in your body. Mm-hmm. Okay, just feeling your body right now. And as we get to right about here, you can see the swelling, edema. It pulls right in there, right in this area, T4. Tender?
Yes.
Okay, fine. And you can see a lot of the swelling in through here. I'm not getting pressure here right now, so we're not adjusting something if there's no pressure. You know, we learn in school the number, you know, we talk about it. What's the number one contraindication to adjusting a segment? And, you know, we would say, yes, cancer, tumors, fractures, things like that. And ask that a different way. What's the number one contraindication to adjusting a segment, a spinal segment? Is a normal segment. If it's normal, why adjust it? Does that make sense? Does that make sense? Yes. And it doesn't mean just because it hurts or just because of this that you got to go through your findings. And the idea is we go through the exam to get the objective findings and put together kind of how we're going to resolve this, right? Mm-hmm. Static palpation. Okay, and same thing here. You can see a lot of puffiness in her sacrum. If you look from the top here, you can see this is the puffiness I'm talking about, okay? Right there. Okay. All right, now let's check the SI joint on the left side. Top of the joint, middle of the joint, bottom of the joint. It's more there on the top, correct? Mm-hmm. Okay, right side. Top of the joint, middle of the joint, bottom of the joint. What? More on the bottom. Yeah, more on the bottom. And that's consistent now. If we go to her x-ray, she has a PIEX left pelvis. We had a little bit of sacrum there. We're not dealing with any rotation as such. What I'd like to do with her today is we're going to set T4. T4 is a side slip. We're going to lightly set the sacrum and then end with the pelvis. Okay? Sound good? And then you'll get your walk in and you're going to go get your new films and we're going to see where kind of things are at. This is consistent with what I'm finding on the x-ray, but things have shifted elsewhere. And that's why we're sending for new x-rays, okay? Let's start right side down, please. And let's start with the pelvis. Hi. You have some good news we're going to talk about later too, yeah?
Yes.
Yeah. Bottom leg straight, top leg is bent. Slide your whole body forward. There you go. You good?
Yes.
Okay. So we're doing a PIEX, involved side up. We're on the PSIS. We're on the posterior lateral aspect of the PSIS with a piezoform, soft piezo contact, right on the posterior lateral inferior PSIS. Now, I'm going to roll you slowly. We'll do a slight push-pull. We're going to come through the joint, P to A, and we want to torque counterclockwise. Okay?
Okay.
Gotcha. Home run. Come up slowly, please. Now we got a little movement in that left side. Face down on the high-low, please. Now, T4 on the X-ray is a PLS with a left side slip. PLS left side slip. Typically, we would do the PLS from the left side, but because of the side slip, we have to go to the opposite side. We're going to do a transverse contact with an opposite torque. And I'll show you. You good there? Good. 1, 2, 3, 4. So I'm coming on the transverse on the opposite side, straight through. There you go. Now I'm going to come to the PLS side. 1, 2, 3, 4. And spinous contact, set it a little more, P to A. Relax the shoulders, please. That's a home run, lady. Bueno? Cool. And S2. Slide up a tiny bit, please. Good. Deep breath in. And out. All good. Gotcha. Hi. Hold my hand, please. Come off slowly, and let's walk. Now, as you're walking, tell us if anything is different.
My back doesn't feel as tense in the middle, where it really does.
Okay.
Because I usually kind of shrug back like that. But I also feel like I'm not putting a lot of, like, it doesn't feel so much pressure on the knee.
Less pressure on your left side, correct? And how about the right? Because you're not on the back right heel as much now, by the way.
I feel like it's kind of more balancing out.
Yes, ma'am. Walk one more time, please, and we'll rescope. Pretty cool, huh? Dr. Gonstead had a saying, chiropractic always works. Never question the principle. Always question the application. Have a seat, please. Does that make sense?
Yeah.
All right, young lady. Let's run the meter and see. Starting at the base. Neck is clear. Low back is clear. Sit up straight, please. Back slowly towards me in extension. Good. That's 5. Bueno. S1. Bueno. S2. Bueno.
That's a little sore.
Little sore there. S3. Down. Tender.
Yeah, those two spots.
Those two spots. Okay. Right, left side. Top of the joint. Middle of the joint. Bottom of the joint. That's moving better on the top now. Do you feel that?
Yeah, I just feel tension on my trap, or not trap.
More here.
Yeah, under here.
Okay. Other side, please. Bottom, middle, top. Feet together. Open and close the knees, please. Yes, ma'am. Feet together. Open and close. Right side only. So now when she does the right, there's less movement on the SI. Do you feel that? Yeah. Right side only. Sorry, left side only. Left side only. And less pull here as well. Good stuff. Sit back, please. I'm going to do your shoulders, okay? Over. Over. Around. There you go. Ears. Stand up for me. Let's check the hands. And squeeze. Got good hands, yo. Squeeze. So Karina is back. We got some good news. Can we share?
Yes.
Okay. So she's back. She wanted to get rechecked. Obviously, whatever happened didn't work out for you. It's okay. You're here.
Yes.
And the good news that she shared with us is that she wants to go to chiropractic college.
Yes, I do.
And you're in Texas.
Yes.
And there is a great college down in Texas.
Yes.
Okay. And there are a lot of great Gonstead docs, a lot of great Gonstead students down there. So I'm excited for her. She's going to get her new films. We're going to compare before and after, kind of see where things are at, even though you had a few adjustments. I kind of want to see what happened over the year.
Okay.
And we have another guest who's also visiting from another state, from Colorado, who also decided she wants to become a chiropractor. And I think both of you are okay with coming together, and we're going to have a kind of a little master class with Dr. Rahim this afternoon. Sound good?
Sounds good.
All right, young lady.
All right.
I'll see you this afternoon.
Thank you.
You're welcome.